to one more important indicator. I will not say indicator, but one more important term over here, that is the HALE, health adjusted life expectancy, right? So health adjusted life expectancy, let's talk about that as well. So HALE, that is health adjusted life expectancy. Health adjusted life expectancy. Okay, so don't worry guys, I will talk about how the MCQs they're asking you from these topics. Okay, so that you get overall picture in your mind that what kind of MCQs can be asked. Okay, so health adjusted life expectancy. Okay, so what is this? Basically it is a very good indicator. It is kind of a positive indicator guys, right? It gives you good vibes. So it is a positive indicator. It is a positive indicator. What do I mean by that positive indicator? So basically we are saying that number of years any kind of population spent in a good health, right? So this particular indicator applies on a whole group, right? Whole group of population basically. So for India it could be different, for Germany it could be different, for US it could be different, for UK it could be different, right? For different countries there could be a different health adjusted life expectancy, right? Understood? So this is the broad parameter, this is a broad indicator. Why is it positive indicator? Because it is talking about the positive things. It is talking about the number of years any kind of population has spent in the good health, right? So what does it say is the number of years a population, okay, number of years spent by a population, I would say, number of years spent by a population in a good health, population in good health, right? So it is measured at a country level, right? As I said, for the India it could be different, for China it could be different, for UK it could be different, right? So measured at country level, right? So it is a positive indicator. It is a good indicator for health status of a country. Good indicator for health status of a country. These are all MCQs. Health status of country. Okay. So on a broader picture, you should remember that they are talking about what? They are talking about a country. They are talking about country. It is not regarding a special person or special group of population. They are talking about the broader level. They are talking about the population over here, right? So this is the HDI. This is also a very good indicator. This is also indicator for efficiency of health system in a country. Okay, this is also the indicator for efficiency of healthcare system in a country. Okay, so how efficient a healthcare system is there in any kind of country, it depends. It is actually measured by the HALE, that is the health adjusted life expectancy. Okay, so this is about the health adjusted life expectancy. One more thing, it is actually calculated by life expectancy minus DALY. This is your daily adjusted life years. Okay, daily adjusted life years. Okay, so this can also be asked. Okay, however this has not been asked, but these are your MCQs that it is measured at country level. It is a good indicator for health status of a country, right? The number of years spent by a population in a good health, indicator for efficiency of healthcare population. These are all your MCQs. Okay, now moving on to the next one. This is the Sullivan Index. So what is Sullivan Index? Very easy to understand guys. Why is it so? Because Sullivan Index is actually similar to the HALE which we have just talked about. In the Sullivan Index they are saying that the number of years spent by a person in a good health. So in a HALE I told you we are talking at the level of country, right? India, China, Pakistan, or different countries, right? But Sullivan Index, I am talking about a particular individual, right? So number of years spent by a population in a good health, HALE, health adjusted life expectancy. Number of years spent by an individual, number of years spent by a person in a good health, that is your Sullivan Index, right? So number of years spent by a individual, right? Number of years spent by an individual or spent by a person, whatever you want to say, spent by an individual in a good health. Okay, that is called as the Sullivan index, right? So usually it is calculated like life expectancy minus DALY, right? Now we are talking about the person. In the HLE we were talking about the population. So again, life expectancy minus DALY, right? Here we were talking about the population overall. Here we are talking about individual or any person. Okay, so is it, can I say, is it individual type or is it population type or population level? It is the individual type, right? So I can say that individual type. Okay, so how you should remember this? Just try to compare with the HALE and the Sullivan. HALE at population level and the Sullivan index at an individual level or the person level, right? Becomes very easy to understand. Now just few words actually about the international classification of disease, that is the ICD. ICD is your international classification of disease. International classification of disease, right? So just now in the January 2022 we got the updated version of the ICD. So previously we had the ICD 11, right? So now in this year they have just introduced us with the ICD 11, right? So now we are having the ICD 11. So it is actually launched on which date? They might ask you this. So launched on New Year of 2022. So that was 1st of January 2022. So recently it came into the picture. So ICD first, initially we had the ICD 10, now we are having the ICD 11. So basically this version they are talking about the 27 chapters, where the 26th chapter they are talking about the health, and one chapter is the chapter X. One chapter is the chapter X. Okay, so just remember this, okay, because in future they might ask you this, because initially we had the ICD 11 previously, now we had the ICD, now previously we had the ICD 10, now we are having the ICD 11. Okay, so that's why they might ask you that when did the ICD 11 came into picture. So that was 1st of January 2022, New Year of 2022. Okay, fine. Now moving on to the next topic now, guys. So we have talked about almost all the indicators, right? We have talked about the mortality indicators, we have talked about the morbidity indicators, we have talked about the HALE, health adjusted life expectancy, right? We have talked about the Sullivan index, right? We have talked about the disability indicators, then we had to talk about the service indicator, socio-economic indicator, right? Now we are left with the health or development indicators or health or development indicators. So if you will combine the indicators, what you will call this? Yes, I told you in the initial few minutes, that was index, right? So index is a combination of all the indicators, right? So here let's talk about the health or development indicators, or I can say indices or index, okay, because we talk about the small indicators in that. So health or development indicators or indices, right? So let's talk about that. Health and development indices. Okay, so here we shall talk about what we shall talk about. First thing is two important I would say the terms you need to remember, or I would say the indicator you should remember. That is, one is the physical quality of life index, right? One is the physical quality of life index. Question comes very frequently from this. What is this PQLI? Physical quality of life index, right? Another one which you should remember, that is the human development index. Okay, I will come to that, but first let me just talk few words about this physical quality of life index. What you need to remember in this particular indicator or index, I would say rather. So here we are talking about the, as the name suggests, here we are talking about the measuring. We are actually measuring the quality of life, right? Here we are measuring the quality of life. It measures quality of life. It measures quality of life. Okay. So it measures the quality of life. They are talking about the range also, guys. Sometimes they talk you about the range, and this has been asked as well. So range, if somebody will be asking you 0 to 100, very simple answer. Range, if they are asking you 0 to 100. Okay, it is talking about three important components. It is talking about three important components, guys, and these components are tested very, very frequently by the examiners, right? So components are very, very easy to understand. Look, there are just three components. First one is, okay, A. First component is life expectancy at 1 year of age. Life expectancy at 1 year of age. How would you remember just 1 year of age? Just remember PQLI, right? I means first. So just remember that life expectancy at 1 year of age. Why I am saying that life expectancy at 1 year of age, you should remember this, or otherwise you might have confused this, because after this I will talk about the Human Development Index. There I will talk about the component that life expectancy at birth. So which one is having life expectancy at birth, which one is having life expectancy at 1 year of age? You might confuse these two in the exam. Okay, because both options will be present in the MCQs, right? Both options they will give in the options that life expectancy at 1 year of age, life expectancy at birth. So are they talking about Human Development Index? Are they talking about the Physical Quality of Life Index? You might confuse over there. So that's why, for a reference purpose, just remember life expectancy at 1 year of age, PQLI. So in the name only it is saying 1, life expectancy at 1 year of age. Okay. B, that is effective literacy rate. Okay, they are talking about effective literacy rate. And if you remember, guys, effective literacy rate, I told you that a number that a person who can read or write in any language, okay, providing that age is more than 7 years, right? So that is the effective literacy rate, right? One was the simple literacy rate, that was that a person can read or write in any language providing the age was more than 15 years. So here I am talking about the effective literacy rate. Then next component is the infant mortality rate. Infant mortality rate, right? IMR, or infant mortality rate. What is infant mortality rate? Mortality less than 1 year, or death before 1 year of age, that is this. So mortality before 1 year of age. Mortality before 1 year of age, that is the infant mortality. These components are very, very important, because generally the question comes, which of the following is not a component of PQLI? Which of the following is not seen in PQLI? Which of the following is seen in PQLI? So these kind of three components, okay, again and again they will be repeating here and there. Okay, and generally they will try to confuse you between Physical Quality of Life Index and the next one which I'm going to talk about, that is the Human Development Index. So let's talk about this important. Okay, so this was the first one. PQLI, and the second one I'm going to talk about now, that is your Human Development Index. Okay, Human Development Index, and Human Development Index, that is abbreviated as HDI. Okay, in the PQLI I talked about the range 0 to 100, MCQ, important. It measures quality of life, important. Components are very, very, very important. Okay, so here in the Human Development Index we shall talk about the component, but first let me talk about the range as well. So range over here is just 0 to 1 or 0 to plus 1. Okay, this is not minus 1, 0 to 1 or 0 to plus 1. Okay, so that is the range of the Human Development Index, 0 to 1. In the PQLI, 0 to 100. That is also the confusion point. Okay, they will ask you what is the range of what is the range of Human Development Index or the PQLI. Okay, so please do not confuse over here, MCQ. Next point, components of Human Development Index. Okay, very, very important components are present over here. For an example, first component. Okay, I told you life expectancy at 1 year of age, PQLI. Life expectancy at birth, if I will say, then it is the Human Development Index, right? About the knowledge part now. Knowledge part, I mean literacy, right? I told you effective literacy rate was the component of PQLI, that was Physical Quality of Life Index, right? Here I am talking about the two components. In the knowledge part, we are talking about the two components. One is the expected years of schooling, and another one is the mean year of schooling. So mean years of schooling of a child, mean years of schooling and expected year of schooling, right? How many years the child is going to the school, for an example. Okay, this is a component of human development index, right? It is showing the development. So next component, C component over here, is that is the standard of living, right? So decent standard of living basically. So decent standard of living. Okay, it might show the income and all. So it is the real gross national income per capita, right? That tells us about the per capita in US dollars. So that tells us about the standard of living of a person. So 3 components, guys, very easy. Life expectancy at 1 year of age. Sorry, that was PQLA. Life expectancy at birth. Second, the knowledge, that is the mean year of schooling and the expected years of schooling. And the third component over here is the standard of living. That is that the gross national income per capita in the US dollars, right? So I hope you are clear with these components. One more question they ask you very frequently, that basically yes, so this is the best measure of standard of living of a population. This is the best measure of standard of living of a population. Okay, MCQ again, of a population, right? Very important. So we have talked about till now range. I talked about 0 to 1, 0 to plus 1. So this is about the physical quality of life index and the human development index. Now I'm moving on to one very important index, I would say, that is the historical index of human development, right? So another one, that is the historical index. So I would say third one, historical index of human development. I can say HISD. Okay, so historical index of human development. So what do I mean by that? Usually here also we are talking about the components. So what are these components? So in the health indices, usually the components are there which you need to focus upon. So components are over here. Let me tell you: life expectancy at birth. Okay, so like in the human development index we have talked about life expectancy at birth. Here also B is the GDP per capita, GDP, gross domestic product per capita, but excluding the foreign national income, whatever income is coming from the foreign countries, we will exclude that, right? So purely it would be the any country's income. For example, if you talk about the India, whatever income is coming from the external sources, whatever income is coming from the foreign capitals, we will not include that, right? So excluding the foreign national income. Okay, and third component they are talking about, that is the gross enrollment rate. Okay, and here we shall talk about the literacy rate, that is the adult literacy rate. What was the adult literacy rate? A person who can read or write in any language providing age is more than 15 years. In the PQLI we have talked about the effective literacy rate. Here in the historical index of human development, I am talking about adult literacy rate, I am talking about life expectancy at birth, and I am talking about the GDP per capita excluding the foreign national income. Okay, understood that. Now I am going to move into one more important term. So by the way, the maximum human development index is found in the Norway. Okay, so kind of a factual data that Norway is having the maximum human development index. Okay, I have not been asked yet, but just a factual data. Fourth component over here. Okay, so till now PQLI, physical quality of life index, human development index, second. Third one we have talked about historical index of human development. Fourth one I am talking about the multidimensional poverty index. So multidimensional poverty index. Okay, multidimensional poverty index, or I can say that MPI, right? Multidimensional poverty index, right? So in a nutshell, multidimensional poverty index, it is just opposite to the human development index, right? Just opposite to the HDI. Here we are talking about the poverty basically. So this is just opposite to the, because in the human development index I talked about that it is the best indicator for measurement of standard of living. Here I am talking about the poverty, right? It's just opposite to the HDI. So opposite to the human development index, right? Here we are talking about the poverty. So poverty is taken into account. Poverty is taken into account, right? Isn't it? Now, it is actually talking about the considering the death rate actually. Whatever amount of population is getting passed away below the age of 5 years. So under 5 mortality rate, right? In the poverty, we are talking about the under 5 mortality rate, right? Because that is not a good thing, because some in the slums or in the regions who are heavily affected by the poverty, in these areas what might have been happened, right? The problem might be, simple problems might be there, and the child might have died, right? They could not get the proper treatment for the diarrhea, they could not got the proper food. So due to the malnutrition, due to the kwashiorkor, marasmus and all of these things, okay, due to the improper care and the treatment, right? Due to all of these reasons, okay, where the death could have been prevented also in the poverty regions, okay. So those kind of death might not be prevented because of improper healthcare facilities, or not having the access to the good healthcare. So that is the basic thing. So that's why under 5 mortality rate taken into account in the multidimensional poverty index. Next we can talk about the number of students, number of children who are not having the access to the schools, right? They're not able to get the proper education over there. So, or some students might have got the access into the schools, but they could have dropped out from the schools, right? Due to some problem, for an example, the school fees problem, or due to any kind of reason, right? So school dropout rates, school dropouts, right? School dropout, or we shall talk about the illiteracy rate over here, right? Illiteracy rate, okay, illiteracy rate over here, or the person or the child who could not have studied beyond the class 8 or beyond the class 6, right? So these are also included in this case, right? So the children who couldn't got the access beyond the class 8, so no education, okay, no education after class 8 or till class 8, right? There are levels in the education. We are talking about that the person who have, or the child who have passed the class 8 or class 10 or class 12th, right, like that. So accordingly you can say the grading of the education or the grading of schooling over there. So these kind of children might not have access to the schools and all. So what could be the problem? Okay, most probably it could be the poverty problem or something like that. Okay, so all these indicators, which are, I would say, all these unfortunate bad measures, are actually taken into account in the multidimensional poverty index. So once again guys, it is talking about the poverty, it is talking about the illiteracy rate, it is talking about the number of school dropouts, talking about the number of children who could not have access to the schools, right? So these kind of things we are talking about in the multidimensional poverty index. It is just opposite to the human development index, where we were talking about the standard of living, right? Okay, now moving on to the next one. And if you talk about the multidimensional poverty index in India, right? Multidimensional poverty index of India, it is not a very good number according to WHO. They says it is around 27.5. okay, so just not mentioning over here because the data might have been changed over here. But if you talk about the multidimensional poverty index of highest multidimensional poverty index, that is present in Bihar. Okay, so just mentioning over here, multidimensional poverty index of I would say highest multidimensional poverty index, that would be seen in Bihar. Okay, that is seen in Bihar, and lowest is seen in the Kerala. Bihar, and lowest is seen in Kerala. Okay, I don't think they might ask you this, so just a matter of factual data. Okay, then moving on to the next question. In India, we have talked about this. Highest MPI in Bihar, lowest MPI in Kerala. Okay, maybe because of high literacy rate in Kerala, the multidimensional poverty index is very low, because I have talked about the illiteracy rate, right? So the illiteracy rate is very less in Kerala, so that's why the multidimensional poverty index is lowest in the Kerala, okay, among all the states in India. Now, we have talked about physical quality of life index, we have talked about the human development index, we have talked about the historical index of human development, we have talked about the multidimensional poverty index in the health indices, and now we are talking about the last one, that is the global hunger index. Now, global hunger index is actually talking about the combination of all of those which we have talked about. Global hunger index, right, or GHI, that is a global hunger index. Global hunger index, right? In the global hunger index, it is a combination of all other indicators, right? It is the simple arithmetic mean of all other 4 indicators which we have just talked about. All 4 indicators, I mean physical quality of life index, human development index, historical index of human development, and the multidimensional poverty index. This is a combination of all 4 these. So combination or simple arithmetic mean of all 4 indicators of health, right? All 4 indicators of health which we have just talked about, right? And what are the components over here? Again, guys, what are the components that might be asked? Okay, and usually they are asking you the components only as far as global hunger index is concerned. So components over here are, first component is, you can say, the under 5 mortality rate, okay, unfortunate deaths, okay, and for under 5 mortality rate, the wasting rate or the stunting rate, okay, and undernourishment rate, okay, basically in adults. Fine. So these are the important components as far as your global hunger index is concerned. So once again, under 5 mortality rate, then we have talked about the wasting or stunting rate, and then undernutrition rate in the adults, right? Now let's try to apply our knowledge in these MCQs. Okay, so let's talk about them as well. So here we can see that true about quarantine, right? I had told you about the difference between the quarantine and the isolation. Quarantine is done for the apparently healthy individuals. Isolation is done for the diseased people, right? So here, true about quarantine, restriction of movement of infected patient, no, that is the isolation. Restriction of movement of healthy contact of an infectious disease, yes, this should be the answer over here in this case. Restriction of movement of healthy contact of an infectious disease. True about PQLI. PQLI is your physical quality of life index, guys. So yes, you should tell me the answer over here. PQLI. I means, yes, I'm hearing the answer, that is 1 year. So life expectancy at 1 year, infant mortality rate, and the effective literacy rate. Got it? Next question. PQLI lies between, talking about the range over here. Yes, I'm listening the range, that is 0 and 1. No, that is for human development index. They are asking you for PQLI. Yes, I heard it right. That is the 0 and 100. 0 and 100. Which of the following is true about the human development index? Right? So human development index, yes, tell me the components. Just repeat the components. Yes, so here among the options, you can see life expectancy at birth or 1 year. Life expectancy at birth, very nice. So life expectancy at birth. Okay, then HDI consists of all except. So human development index, it is consisting of what? Except, they are asking you. Remember, except, this is very dangerous word, except So over here, real GDP per capita income, yes it was. Yes it was. Life expectancy at birth, yes, 1 year was PQLI, birth is HDI. Mean year of schooling and expected year of schooling, yes, all three are the components. All three are the components of Human Development Index, and range was 0 to +1. Okay, so here answer became what? 0 to 100? No, it is for PQLI. It is for PQLI. So this is the answer, because they were asking you accept Human Development Index, right? Okay. HDI, they are asking you about the range again. Yes, I need the answer. Any number? No. No number? No. So it is the 0 to +1. So 0 to +1 is the answer. Right? Simple question. Not included in PQLI. Literacy, right? Yes, it was. They were talking about the effective literacy rate. They were talking about the effective literacy rate. That was person who can read or write in any language, providing age is more than 7 years. So effective literacy rate they were talking about. Yes. Life expectancy at 1 year. Yes. They were talking about infant mortality rate. Yes. So what was not included? Income. Income was the part of which index? That was Human Development Index. So income was the part of Human Development Index, not the PQLI. So this is the answer. Okay. Next question. Image of iceberg phenomena. So if you guys remember, in the previous section only I have talked about the iceberg phenomena, where I have talked about the emerging part of the iceberg which you can see from your eyes, right? That is above the sea surface. But what you can't see from your eyes, that is the submerged portion of the iceberg. So they are asking you what they are saying, that with value of 12 cases, okay, with value of 12 cases mentioned above the surface, these are the apparent cases, right, which you might be able to diagnose it clinically with the help of your knowledge. 20 at the surface. At the surface, I told you, that is a demarcation line, right? A demarcation line means sea surface, right, where you might diagnose it clinically, or you might take the help of investigations as well. Okay, so it's a combination of both. 50 beneath the surface, that is the submerged portion. Submerged portion tells you what? Submerged portion tells you, yes, that is the inapparent cases, right, which you can't see from your eyes, right? So these cases are becoming difficult for us to diagnose. So we might take the help of so many investigations, right, because we are having so many differential diagnoses in our mind, and we need to rule out with the help of the investigations and the scans, right? So what disease had the following pattern? So I told you the disease which are showing the iceberg phenomena, the disease which are not showing the iceberg phenomena, right? So if you will remember smartly, disease which are not showing the iceberg phenomena, then you can answer these kind of questions very easily. So disease which are not showing the iceberg phenomena, I just told you 3 diseases, which was MTR, right? They were measles, tetanus and rabies. So measles, tetanus, rabies, they do not show iceberg phenomena. They do not show iceberg phenomena. Do not confuse it with the rubella. R for rabies, R for rubella. Rubella shows the iceberg phenomena, but rabies do not show the iceberg phenomena. So please be very cautious in this case. So measles, tetanus, rabies, they do not show iceberg phenomena. I told you, please refer to the previous section as well. So here, which disease has the following pattern, they are asking you, and they are asking you 50 beneath the surface. So iceberg phenomena they are asking you. Okay, so it is showing the emerging portion of the iceberg also. They are talking about the demarcation line, sea surface also, and the submerged portion also, right, showing the iceberg phenomena, which shows the left out option is the tuberculosis. So tuberculosis became the answer. Now in iceberg phenomena, submerged portion they are asking you. Iceberg phenomena, submerged portion tells you what? Tells you about inapparent cases or undiagnosed cases. So this became the answer, undiagnosed cases or inapparent cases. Right? So I hope you were able to answer all of these questions based on what we have discussed in our theory section, right? So thank you so much for joining this session, and I will see you in the next chapter. Thank you.